It's the best thing I've ever done. It's actually changed my life, to be honest, and I'm not exaggerating.
So this is a lady who is 76 years old, who had type 4 lipedema, in which the entire lower limbs and the arms were involved, and she was stage 3, so she was actually quite large. She's been troubled by lipedema for most of her adult life, and she previously saw other surgeons, one of whom told her to go and live with it. And unfortunately, the lack of awareness and understanding by many doctors unfortunately leads to patients not seeking the correct treatment for lipedema. She's been previously investigated by the vascular surgeons who did not find anything wrong with her venous system, and then she came to me subsequently for treatment for her lipedema. And at the time she was suffering from throbbing pain in her legs. She had knee pain with the left more worse than the right. Her legs were very heavy. She couldn't wear boots on her lower limb, on her feet, and her legs were quite unsightly. And she had these large overhangs of fat at the ankles. 4 months ago, she underwent lower limb lipedema liposuction from the ankles to the suprapatellar region here, and a total of 5.4 litres of fat was removed. She's now completely healed, well, actually I should ask you, how do you feel?
I feel great, actually. I feel really myself again. I feel lighter, I feel younger, I feel healthier, I feel bright, I don't trip when I walk, I don't have my sciatic pain, I don't have my knee pain, I don't have my back pain, I don't have to lean on my friend when I'm walking. I just feel this is amazing.
So before you had knee pain, tell me about that. What's the pain like now in your knees?
Well, I had an arthroscopy because the pain was excruciating in my knee and I couldn't actually go upstairs or come downstairs without using little baby steps. So I had an arthroscopy and my pain continued, and he said the only thing I can do for you is a knee replacement. I had injections in my knee and it never took the pain away. Now, I very rarely get any ache in my knee.
This is not an uncommon story that patients tell me, and what I found is that if you address the pretibial fat pad here, that often the knee pain improves, and I don't quite know why. It may well be that the knee pain is actually soft tissue pain, but the patient can't differentiate between the two. So if you address that soft tissue, the pain is significantly improved. Now, if we look at her limbs, the first thing to say is that they have a very deflated appearance. They're much slimmer than they are beforehand. There is some skin laxity, and in a 76-year-old, this is not uncommon, and actually it's something quite expected, really. The younger patients who've never had children, those who've never smoked, they're the ones in which the skin shrinks extremely well. But in the older age group, then obviously there's some degree of skin laxity left after the surgery. She does have some varicose veins, and you can see they're still there. Otherwise, you know, her limbs are nice and soft. There's no edema whatsoever. Her feet are entirely normal, and she's walking really well.
And I'm wearing crop trousers.
So are you feeling more confident now?
I couldn't actually find any trousers. I had to buy, we had the widest ones, and I couldn't cross my legs in case you saw the fat hanging over my ankle. Now on holiday I wore crop trousers because I was not afraid. It was liberating.
Right, okay. She does still have some fat, residual fat on her calves, and she's going to come back for another operation in which I shall remove the fat from the calves and also address the fat on her posterior arms. And even as I feel these arms, they feel very cold, the skin here. And that's a very characteristic feature of lipedema, in which the skin on the posterior arms feels very cold to touch. You also describe your legs as being less heavy now.
Oh yes, it's almost like you've got a little spring in your step. I plodded about before, and now I actually, I feel younger with my walking.
Right.
It's amazing.
And so do you think it's been a benefit to you?
Oh, absolutely. It's the best thing I've ever done. It's actually changed my life, to be honest, and I'm not exaggerating. I've got quite good self-esteem, but now I actually don't feel embarrassed. And it's the heaviness. You don't realise. And I changed all my shoes because my shoes were worn down, and when I put them on, I thought, oh, these shoes feel terrible because my feet can fit into shoes better, and I'm lighter.
Great, that's great.
It's super.
Excellent. There isn't really an upper age limit that I have to treat women with lipedema. It's all about what the patient desires and what their quality of life is like, and those factors will determine if they're a suitable candidate for surgery. But as you can see, if a 76-year-old lady can go through it with a fantastic result, then it really is applicable to any age group that's out there.
But I've got to say, ladies, Mr Karri is really good at what he does.
Thank you
And he's
very
got
much.
a very good manner.
Thank you.
And don't be afraid.
Thank you.
Because it'll change your life.
Thank you.